Good evening. Stretched to breaking point. Too few beds and years of underinvestment. These are just some of the challenges confronting Scotland's health and social care sector. As pressure on staff continues to mount, calls are growing for urgent funding. Gráinne Grehan has been speaking to those on the front line.
You never know what you're coming into. You never know if there's going to be enough staff. It's that constant firefight.
There are pressures across every inch of the health service. The community is no exception. At this hospital in Stonehaven, every bed is filled just like yesterday and the day before. There are almost 170 beds in community hospitals across Aberdeenshire, but there's often a waiting list to get in. Today, there's 25 people waiting to be admitted, either from hospitals like Aberdeen Royal Infirmary or from GPs and home as well.
I think if we could put 1 million more beds out, and that might not necessarily, we'll just fill them again. What we need to ensure is that our community provisions are really robust, and that is increased care packages being available. You know, that investment into our social care, I think, is really, really needed, and that is currently, one of the big barriers that we've got. Also, long-term care.
A review earlier this year found NHS Grampian would need an additional 170 beds to improve patient flow. But unions warn bed capacity isn't the only issue. With more people leaving the profession on the rise, those who remain are working tirelessly but are being stretched to breaking point.
It's like a snowball effect, because the less staff that are available, the increased workload on the staff that are left, that adds pressure onto them, and they're more likely to leave or look for work elsewhere. The funding model for social care needs further investment.
At this care home, their top priority is providing the best quality.
You need to have that passion, or it would be easy to just walk away. It's not an easy job every day, it is very stressful. It can take a lot. You see a lot of things that you would never imagine that you would see or have to deal with, and it does take a strong person to be able to deal with that and continue and still hold on to that passion.
But over the past 5 years, NHS Grampian has seen a 9% increase in its older population, higher than the rest of the country. And an ageing population is contributing to those pressures. But the Health Board remains the second lowest funded board per head of population.
Population's ageing, but we have younger people as well. There's less availability for people with learning disabilities and things, so these people have to be placed as well. So it's just that vicious circle of never enough beds. There's not enough beds in ARI, but if we did free them up, because there's a huge percentage of beds that are blocked, then we probably could flow things a bit better.
The Scottish Government says they've provided a record $21 billion for health and social care this year, and that they've invested $200 million to provide patient flow and enhance capacity. But for those on the ground, they say pressures don't look set to ease as they go into their busiest time of the year. Gráinne Grehan, STV News.